Hi, my name is Ana Luz Hernandez, and I am currently a patient of Betsy, Portugal, through UMC's midwifery program. I am currently pregnant with my second child, and I am at about the tail end of week 33. So in the last trimester, I've definitely noticed a huge increase or a huge spike in her movement inside the womb and how pronounced it feels. One of the things that I've observed looking back at my first pregnancy and this pregnancy is how sooner I was able to detect my daughter's movement compared to my son. Even at my first ultrasound, which I think was when she was close to 3 months, it was real curious to see her movement, because at that point I distinctly recall when the technician focused in on the image that she was repeatedly punching me, which I thought was really just interesting, seeing that the fetus was already moving that quickly or that actively at that point in the pregnancy. At my most recent visit with Betsy, she did make the observation that she is currently positioned sideways, and so I'm hoping that that'll change as I continue to proceed along in the pregnancy in the next 6 weeks. I do feel her moving around, kicking and punching, not as often as my son. He did that repeatedly within the span of 30 minutes. He would punch me 50 times. She's not as active, but she's still moving a lot around. I can feel her shifting around, and so it makes me very curious to see what her temperament will be like once she's actually here with us as a family. I do have an ultrasound scheduled very shortly, and so at that point I will be able to see how much more she's grown, and then obviously be able to see her movement on the screen. So I'm very excited and looking forward to that.
When you're looking at fetal movement and how the baby is responding during the pregnancy, every pregnancy is different. And the reason you're going to maybe notice when Maximo was in utero, Maximo has his own personality and his own way of developing and his own being. Now we're looking at Penelope, and Penelope is going to have her own behavior, her own response to a book or to music. Just like you're an individual, your babies are individuals. So every pregnancy is different. You still go through the pregnancy the same way, but you're going to notice that each baby is different. And that's what's important, because it gives you the opportunity to identify each individual baby and how they're going to develop in their personality. And you wouldn't want a cookie cutter of the same child, you want a different child. And so you're going to see those behaviors change. We also want you to pay attention to your baby's behavior. When we think about baby's behavior, we're thinking about, does the baby move? When does the baby move? How does the baby respond to you're talking to the baby, you're listening to the music, and the baby will respond in a certain way. Also, one thing that I like to do, as opposed to having you mark down every time the baby kicks, I like for you to read a book to your baby and then respond. How's the baby's behavior? Does the baby respond to your reading, to your voice? And babies move all the way up until they're born, so we want to make sure that you're paying attention. And when that behavior changes, where you're not feeling comfortable with how the baby's reacting to your voice, to music, to food, whatever the baby usually responds to, if that behavior changes, then that's an indication that we need to monitor and do a little bit more surveillance on how the baby's acting.